Hi, so I'm Justin Kendrick. I'm SVP and CEO of Memorial Hermann The Woodlands Medical Center and Memorial Hermann Northeast Hospital. Yeah, so thanks for the opportunity to talk today. I think the real intent behind this is really try to give every member of the community possible a better understanding of really what's happening with this latest COVID surge. And I guess I would start out by saying I know that we're all tired of talking about COVID. Every one of us, it's impacted lives and our lives in various different manners and things like that. You don't have to, be an individual in the healthcare industry to feel the impact. It certainly had its impact throughout all different industries and so many ways throughout our community and how we live normal life and such. But there are some real strong variables, some strong factors that are going into this latest surge, and it's honestly, it's kind of smacked everybody upside the head a little bit with how fast it has happened. And I think that's the main difference with this surge that we're seeing here compared to what we saw in January or last fall or different things like that. The way I've really put it to people is, I took a week off with my family, went to the beach, we did our deal, we stayed in our own house and tried to control our own environment and things. And when I left, and that was in mid-July, we were in the single digits of COVID positive cases, and we were all figuring out that, or thinking that this just might be what we're all living with COVID, and it is what it is. When I returned back from a week of vacation, we had more than 40 patients in the hospital that were COVID positive, and really, especially over this past week, we in fact doubled again from those kind of numbers from last Thursday or middle of last week, and when we started off this week on a Monday morning. And so where we are really approaching things is for contextual purposes, we're really at about 75 to 80% of the COVID positive cases within our hospitals, not just Memorial Hermann, but everywhere, of where we were at in former surges. And again, those took a lot more longer of a time to creep up, but this has just really escalated so incredibly fast here this time. And so where we are at is our own facility, Memorial Hermann The Woodlands Medical Center. About 25% of our licensed beds are taken up with COVID positive patients. We have other facilities throughout the system and in our area that just may be smaller hospitals and might be around 50% of their licensed bed counts. And really, when we start getting to that point, our ability to provide other levels of care for individuals and stuff starts being influenced. And I think that we're seeing that throughout our region right now with the other hospitals and such like that. And so really the intent is to come out and share why we're seeing this, as well as look to everybody to start taking those personal levels of responsibility and that we know can work in order to flatten the curve this time and start seeing the surge decrease and such. So the main factor really of what we're seeing is that this is becoming a pandemic of the unvaccinated individuals. Really, with all of our tracking of our patient base and such, not only just within our system, but also throughout the country. I think throughout the country, what the CDC is showing is that about 97% of all COVID positive hospitalizations, those that are admitted to the hospital, are unvaccinated individuals. What we are seeing amongst our own system, which we've released out in various ways to the press and such, is really about 99% are unvaccinated. And so again, we have this golden ticket out of the pandemic, but it's not being utilized as much or frequently to the levels of the percentages of other areas of the country right now either. And so really throughout the country where we're seeing surges pop are in those pockets of area with a less percentage of the population vaccinated. And that's really what we are in Houston and Montgomery County and such. And so I think the latest vaccination rates that I saw for Montgomery County was right around the 48.5% look there. And I think for Harris County, it's around 55%, so a little bit different, but nowhere near the 70%, the 75%, the 80% of other areas and such. And so really, again, we know that based upon the patients that we're taking care of right now, uh, coupled with the relaxation of a lot of the safety protocols from masking and social distancing and things along those lines as we've gone throughout this summer, it's just really all coming together to create this rapid surge that we are seeing. And so again, it's really our intent to kind of educate everybody with the facts of what we're seeing. And I know you're going to hear from our co-medical director of our critical care unit here, Dr. Daniel Keevlin, who really takes care of all of these patients within the ICU. And he's going to provide a little bit more perspective as far as the types of patients that we're seeing, because we're certainly seeing a dramatic shift along those lines as well with the age in the population and things. And so really where I would say, moving forward, the best thing that we can do right now is engage in any conversation necessary or possible right now to not only state the facts of what we're seeing with this surge within our hospitals in this Montgomery County area, North Houston area, Harris County, but then also engage in those conversations around the vaccine and safety protocols and such. I know that my phone is always open. I feel like I engage in conversations morning, noon, and night, and really it's our job as a privilege and honor to care for this community. It's part of our job now to be educating the community and really stopping and listening and understanding where people are coming from with any hesitancy towards the vaccination and such. And again, I think Dr. Keevlin can speak to some of the safety concerns that are out there around the vaccination as well, and try to debunk some myths and provide some excellent resources for people to be able to go to further educate themselves and such. So another question that I get asked often is, are all the Memorial Hermann workers vaccinated as well? And we have I think we've done a pretty good job up until now of where really over 80% of our workforce is vaccinated and such. And we have taken the step though this past week, essentially on Monday, to announce our mandatory vaccination policy that's coming out, really enforcing kind of what we're all talking about here, that we know that the vaccine is the safest way out of this pandemic for all involved, and we feel that now is the right time based upon where we are at within the surge, especially with the patient information that we have, that essentially everyone, that 99% is being hospitalized is unvaccinated, plus what our vaccination rates are within the areas in which we live and work. 3, the relaxed safety guidelines that we've been seeing throughout our area, masking and social distancing and such. And then also a lot of the safety, the data that's out there. At this point in time, we've given out over 330 million shots in the United States. We've got about 165 million people that are fully vaccinated at this time. So we've got millions and millions and millions of data points at this point in time. And hands down and through all the research and things, we know that the vaccine is safe. And I think Dr. Keevlin could go into some more of those specifics and such. I do recognize that there's always the concerns about the myocarditis and those side effects and things along those lines. But when you look at from a risk mitigation standpoint, your risk of getting COVID is so much higher, so much higher without the vaccine than any potential side effects down the line, especially being documented with these hundreds of millions of data points and such. That's what's really led us to announce and put forth the plans that have really been in the works for the last several months to say now's the time that we need to make a stand. And we need to ensure that everybody who is working within our organization, being the largest employer in the city of Houston and such, that everybody is vaccinated. And that really includes not only employees, but also our medical staffs, our physicians. It includes our students, our volunteers, our contractors, right? The electrician who comes in to help us out to do work and such. It really involves everybody. We are seeing this throughout, different industries as well. It's not just the healthcare industry. We're seeing it in whether it's big tech or finance or other governmental entities and such, that the data is just becoming overwhelmingly clear. And now's the right time for us to do that as well here. So another question I get asked all the time is, what are we doing about schools and things like that? And I really think that we really are in lockstep with our school leaders, CISD and private schools, and I feel like I've spent a lot of time throughout this past year on the phone with my child's preschool also. But we're having the same conversations in our household as many other families are and such. And I know that our school leaders are making the best decisions possible within the framework of what they have to make decisions by and such, just based upon some guidance, at a state level and such. But back to the same conversations that our family's having with a lot of, as others are, we've got a 9, 7, and 5-year-old that are, they'll be dropped off at David Elementary School on Wednesday. It'll be the first time all of our kids are in the same school. And we've been kind of reflecting back upon what we need to do to keep ourselves safe and our kids safe and such. And, do I like wearing masks? It's not the most comfortable thing, right? Especially in Houston heat and things like that. But the one thing that keeps coming back when we're talking about this around the dinner table in our house is that we've all loved being healthy. And again, as we start talking about the risk mitigation and things along those lines, we've never been healthier as a family for the last year and a half. I feel like before then, it was every single month, one of the kids was passing along something within the family of cold or flu or whatever it was. And this year and a half has shown us that the safety measures that we've been able to put into place of masking and social distancing and things like that have allowed our kids to thrive and not have to sit out from soccer, practices or games or gymnastics or anything else that we do as a family that might get canceled based upon one of us feeling ill. And so I know for our kids, it's kind of taking that approach of, hey, we want to be healthy here, and so this is a great way that we can kind of lead by example as well, but also do it for some of the reasons that I just mentioned, that we all love being healthy. I think one of the things that we're also seeing is just kind of who we are as a family and really who we are as an organization and such, and wanting to go help people. Again, it's our privilege and honor to have been able to care for this community for so many years, and this is now a part of caring for this community, of providing these types of this education and the facts around what's going on here currently and such. But we know that even if you have been vaccinated, you can still be carrying it and such. We still know that kids can be carrying it. Your symptoms are going to be a lot less than when you have the vaccine and such, and so you may not even know it. And so for us, we would hate to be a carrier and to pass it along to another individual, and that really wouldn't sit very well with us or my kids, and as far as kind of who we are as a family and what our objectives are and things. And so again, I say, we're having the same conversations. Part of it is making sure that my kids feel comfortable also, that they know that they're not going to be the only ones wearing masks at school and such. But it's really, again, this is just one way that we can do our part for the community moving forward as we try to figure out a way to flatten the curve. And again, we know the various ways to flatten the curve, and that's to get the vaccine and maintain the safety protocols of masking and social distancing and such, and get us all to a point where we can move forward as a community to do so many of the great things that has made this community so great in the past, and will continue to do so in the future. But it's really going to take all of us. I think that's what we're seeing. We know that we're too susceptible when we only have 50% of our population vaccinated. and that really, puts the burden, on the healthcare delivery systems to shoulder that. How blessed we are to be in this area, to have, the medical center of the North, not just our facility, but so many different others and such. But we all really need to come together here now in order to shoulder the burden equally and figure out our way together to get out of this surge here.
I'm Dr. Daniel Kievlin. I'm the co-medical director for critical care services at Memorial Hermann The Woodlands Medical Center. I've been here the past 4 years and co-medical director for the past year. And I care for patients in all our ICUs, but speaking with you today particularly about care of our COVID patients over the past 18 months. We had our previous peaks, initially last March and April, and then again last summer in June, July, August, and then again in December, January, and February. And our numbers had kind of slowly dwindled down. Patients who make it to the ICU tend to stay there longer than patients who are just admitted to the floor. So although the numbers in the rest of the hospital improved, we were still having half a dozen patients in the ICU through the past few months. Eventually got down to even a little bit less than that, but we've seen a very rapid and dramatic increase in the number of our COVID cases over the past 3 weeks. Hospital went from having single-digit number of patients in the hospital with active COVID to doubling and doubling again multiple times, and now of our 297 licensed beds, we have over a quarter of them are COVID patients. That does reflect in our ICUs as well. We have 4 ICUs with 46 beds, and our main COVID ICU is completely full again. The difference from recently is that many of these patients are much younger. They're in their 30s and 40s and 50s, and all of them are unvaccinated. Since we have had widely available vaccine in January, we've had 3 patients who've ended up in the ICU who are vaccinated. We've had dozens and dozens of admissions since then into that unit and dozens of deaths. And those are virtually all unvaccinated patients. And it breaks our heart as staff. We are committed to caring for anybody who comes in, but we don't want to see needless suffering. And we really want to raise awareness to the community of both what we're doing and the strain that's being placed upon the hospital, and ask for the community's assistance to help us get through this so that we can still provide the care to all of our other patients that we need, and to be able to avoid needless suffering and deaths and morbidity and prolonged hospital stays and potentially long-term effects in some patients. I think one reason that we're seeing a lot more 30s, 40s, and 50-year-olds end up hospitalized right now is because we have much higher vaccination rates in our older population, in our 60, 70, 80-year-old population. So those people are in fact protected, and it's those that are not protected who, with a much more transmissible variant in this Delta variant, are getting infected. And yes, not every person in that age group who gets sick ends up very sick or ends up hospitalized or ends up in my ICU. But when you're talking about vast numbers of them, eventually enough of them are getting sick. And unfortunately, they're all coming in now. I've said from the beginning of the pandemic, I will take care of anyone with this disease process to the absolute best of my ability. But I can't take care of everybody at the same time. So that's why we're really asking people to try to help us flatten the curve right now again and minimize the amount that this virus is transmitting. The people who are going to get admitted tomorrow have already been infected. But what you do today in being able to flatten the curve, mask, physically distance, hopefully get vaccinated, just calm things down a little bit, can avoid an admission in 2 weeks. I would say, as co-medical director and as someone who was honored as Physician of the Year for my work and my leadership during the COVID pandemic, I always keep an open ear to my staff, and we're fortunate that we have 80% of our staff vaccinated. But I have people who ask me questions about, well, what about this? What about that? And I try to keep up with the evidence as best I can. One of the difficult things in this pandemic is, I like to say, we're having to captain the raft as we're building it. This is an emergency. You know, we didn't build a boat to get us through this. We're having to make a raft, and we're having to lash things together. And so that information can sometimes change, and I know that can be confusing to people, or the lack of full information can be frustrating, but I try to answer them as best I can with the information that I have available. I have conversations with staff that run the gamut, things like, oh, is this vaccine going to cause infertility in me? And I would say that there is no evidence of that the American College of Obstetrics and Gynecologists and Society of Maternal Fetal Medicine now do very much encourage vaccination in any woman who's pregnant or thinking of getting pregnant. We've unfortunately had several patients in our ICU who are pregnant who ended up with severe COVID and have had very, very, very serious courses. In the previous 3 years that I'd worked here prior to COVID, I saw maybe 1 or 2 of those patients. Okay. I think that's one element of hesitancy I get sometimes. I also get the question of, well, how are these safe if they're developed so quickly? They're safe in that way because the technology that is utilizing the mRNA platform, the adenoviral platform, are things that were already being worked on. And then the great benefit of the FDA and administrations was to cut through red tape and allow things to be progressed quickly, but safely. Okay. So these vaccines, you know, if you told somebody in 1940, could we build an atomic bomb in 5 years? They'd be like, no way. But that information was being worked on, and you put the resources of people and enough money and cutting through red tape, and you can make an atomic bomb. If you had told them, hey, how can we supply food to the city of Berlin during a Berlin blockade? How can we do that just through airplanes? The US and allied military did that during the Cold War. Great things can be done when there is a great need. So these vaccines, I think, are a representation of that, of great efforts that were done safely. And I often also get a question from, well, this thing is only under emergency use authorization. That is a process by which the FDA is allowing something for an immediate need to be sent out while they're following up the longer term data from the initial trials. Okay, that data is still coming in, and I expect that will already be that the vaccines that have been approved will receive full approval within the next few months. They additionally, during an EUA process, are making sure that the entire manufacturing process is as safe and reliable and consistent as possible. So what they're doing in that is following and seeing, are things going? You may have heard about the Baltimore plant with the Johnson & Johnson vaccine, that they were also preparing to make the AstraZeneca vaccine, and they found that there was a problem in that plant. That was actually a success of the approval process being able to monitor while they're working forward on an EUA. And I would say the last thing in that regard on a vaccine hesitancy of, well, what about side effects? I will tell you that getting COVID comes with a lot of side effects. Blood clots in legs, strokes, myocarditis or heart failure. I've seen that in young patients too. The risks of the vaccines are lower in that than the risk of getting those things with COVID. Okay. And the last point I would usually bring to people is when any new drug or vaccine or medical device is brought on the market, it undergoes, after even full approval, what we call phase 4 study. So that is looking as it's being given to patients. The vaccine or the whatever drug device vaccine has to be followed by the manufacturer and look for rare side effects. We've effectively already had that process, and we have that process ongoing with 330 million doses administered in the past 8 months. And there are some small signals of things like rare blood clots with the Johnson & Johnson vaccine, blood clots in the brain. We've not seen a huge signal, and we already have hundreds of millions of people who have received these vaccines. So when people say, is it safe? I say, this is developed under an emergency, but is developed safely, and I trust that data. I think the last one that I would bring up is I try to engage in individual conversations with staff. I had one staff member who I've spoken with multiple times since the pandemic, and he had a very rare side effect of a vaccine when he was 12. And I've actually gone back and tried to read on that specific vaccine for him. He's a very excellent, conscientious nurse, a wonderful person. But he's been afraid of getting a COVID vaccine because of a side effect he had when he was 12. And in the research that I've done and talking with other specialists, I've told him, I think what you had was very, very specific to that vaccine. I can't tell you that with 100% certainty. I don't have your medical record from then. But doing the research, talking with other experts, I'm trying to provide him that information. And I think that's what we need to do as medical professionals and reaching out into our community now, of being able to address individual concerns that are sometimes very, very valid and try to dig through them to provide a good answer. The Delta variant is driving the surge nationwide. We know from both local data and national data that about 80% of cases are all run by the Delta variant. We do know that the vaccines appear to have slightly reduced effect against the Delta variant, but that they're still doing their job at preventing moderate or severe disease. Okay, that you may get a fever, you may be short of breath for a day or two, but that the vaccines are still effective against that and effective against ending up in the hospital or in my ICU. And that's honestly the most important thing. And even amidst this great Delta surge that we're seeing right now, what I had spoken of previously, that we see virtually no patients who are vaccinated who are ending up in the hospital. Right now, I still am seeing no ICU patients who are vaccinated in my ICU. If there's one thing that everybody can agree upon in the pandemic at this point is that we're all tired and we're all exhausted. We are too as providers. I cannot wait to be beyond this and to be back to some semblance of normal life. But we need to look out for each other right now and to be able to ensure that our community, to look out for our fellow man first and foremost, but to make sure that our community can be safe and that we can be as open as possible. But while we're seeing this Delta variant surge, I really ask the community to help us out. We're going to be here for you. We're going to take care of any COVID patient that comes in and still any other patient with any other medical process. But we've had to accommodate the COVID patients, we've had to limit some of our other things right now. We've had to cancel our elective surgeries. So we have patients who are not going to need replacements. That's not so much of a big deal, but we have patients who aren't getting heart valves replaced right now because we can't do that with appropriate capacity on an outpatient basis, okay, having patients come in from that. We don't want those patients to suffer complications. We want to get back to normal function so that all those patients can be effectively cared for and not have risk of adverse outcomes. So we're asking the community to help us out. We know you're tired, but the things that we can do right now are asking everyone, whether you're vaccinated or unvaccinated, to please mask up again right now. They may not be perfect. I know they're not comfortable, but when you're indoors, please mask up to minimize transmission and try to drop our cases. Please try to, I like to say physically distance instead of socially distance, because I still want people to have their social life. I still want them to have those connections, that emotional support, but trying to avoid doing that, at least in an indoor manner. And when you're having to do it in an indoor manner, in a physically distant manner. And then encouraging really our best way out of this is ultimately vaccination, okay? So if we do those first two things and people just try to limit the amount of travel and high-risk activity that they have over the next few weeks. Anybody who's not vaccinated, if you go get vaccinated today, you're not going to have perfect protection in 2 weeks, but you're probably going to have enough protection. You'll not end up in my ICU, and your risk of ending up in the hospital overall is going to be greatly reduced. And if you are taking a Pfizer or Moderna vaccine 2 weeks after your second dose, you're going to be fine. So if you can mask up, so physically distance, and then get vaccinated, you can help us out so that we can continue carrying in all of our other roles for the community. For those that are already vaccinated, please, please, please reach out to people that you may know who are not vaccinated and talk with them. Share with them resources. We live in a fractured media environment, okay? expertise is sometimes disdained, disliked, looked down upon. But there are experts who have worked on things and have studied pandemics and emerging infectious diseases for years and years and years. This is their job. They do this not because they want to claim, but because they're serving people. And I would say reaching out to various known physician groups. There are two experts that I think are really excellent, that when I see them on a podcast or I hear something, Dr. Paul Offit, who's a pediatrician and a vaccinologist from Pennsylvania, from Philadelphia, and Dr. Michael Osterholm, they will provide straight talk and expertise on how things are going on. Okay, I really, really encourage people, if you see something with them, they are experts that I trust and that I gain information from, but they speak in a manner that is accessible to everyone. So encouraging, if you're vaccinated, other people to get vaccinated, and we'll get through this together.
Well, hey, I appreciate you joining us here today and being able to speak more towards the science of things and really what you're seeing within the ICUs and within the hospital and such. I liked what you said about physical distancing also, right? Not, kind of helping to operationalize social distancing a little bit. I think that's probably the things that most of us have probably missed the most throughout this pandemic, is just those social elements. And I know even the social elements that we've tried to put together here with our own hospital staff and teams and the physicians and such really strike a chord with a lot of people, even though we may be on Zooms and different things like that. But I think to really summarize this time together and with our with where this is heading and our recommendations for moving forward, would you mind just summarizing things that we've been talking about and just how we can get through this surge together and flatten the curve?
Yeah, really just want our community to be able to help us, to be able to help them, right? This is a two-way street. We are here for you. When I decided to move here, my wife is from the Woodlands. I had seen how wonderful a community this was. And when I was coming out of my training, I said, I want to be somewhere where people care about each other and where we can have a wonderful environment to, live, learn, and raise a family, right? And that's really what we're trying to get into for this, is just so that we can continue doing those things right now to help us so that our volumes don't get high, so that we're still able to care for everything with COVID and non-COVID. It's everybody, please mask up when you're indoors. Please even avoid those super congested outdoor activities for right now, okay? No concerts, don't go in a mosh pit, please. But masking up, trying to socially distance or physically distance, as we said, it's just don't have the dinner party for the next few weeks, okay, until we can get these numbers under better control. Let's just try to have their wine night on Zoom or do something outdoors if you're going to do that, please. And then just minimizing those kind of high risk activities. My wife and I, one of her cousins is getting married in September. We've had that booked. We want to go to that wedding so badly and see the rest of her family. But I don't know, if our numbers are still bad, we might very well just have to say, like, we're not going to do that trip right now. Those are really the things that we can ask. And then the last one is, if you're not vaccinated, get vaccinated. Yes, it's a personal choice. I do not deny that. It's every individual's personal choice. But I also ask them to think about what you do matters to other people. Even if you're not going to get sick, or you're not going to get severely sick, you still end up in the hospital, you're still taking up another bed right now, okay? And even if you don't get sick or even end up in the hospital, can you pass this along to somebody else, okay, who could? And protecting our most vulnerable in our community too, our children who can't get vaccinated, people who are immunosuppressed and vaccines may not work as well with them, people who are undergoing cancer treatment. I respect everyone's individual right, but I also ask them to think about the health of other people. Do unto others as you would have them do unto you.
Probably the last thing that I would add is, I hear it from members in the community all the time of passing along the appreciation, the sincere levels of appreciation for our staff. And like you said, we're tired. And our staff are absolutely true heroes. It's not just our staff, it's everyone else who is in a position where it is a privilege and honor to care for anyone who comes through our doors and such. But like you said, we don't want to have to be taking care of those individuals when there's a golden ticket to keep you out of here. And but again, I just want to pass along my personal appreciation to the entire medical staffs and all of our employee partners and everyone who all comes together to make this work. And as you said, we'll figure out a way to get through this together.
Agreed.